Hey, this is the New York City Department of Health and Mental Hygiene's update on COVID-19 for New York City healthcare providers. Today, we have a bit of a different format as we have some very special guest speakers joining us. But as always, please note that you have been placed in listen-only mode. So if you do have questions during the presentation, please submit them via the Q&A portion of the WebEx, and we will address them throughout as well as at the end as time allows. So the slides from the webinar, as well as a recording of what we can make available, will be on our provider page of our website by tomorrow afternoon. And we will also share that information via email to all attendees. Additionally, today we will be issuing several live polls to gauge audience feedback during the presentation. So we thank you for your participation in those ongoing polls, as well as in a final poll that will be issued during the last 5 minutes of the webinar. Today, we are joined by Dr. Uche Blackstock, founder and CEO of Advancing Health Equity, and Dr. Oni Blackstock, founder and executive director of Health Justice, who will be speaking to us about building confidence in COVID-19 vaccines using motivational interviewing techniques. So with that, I'm going to issue the first of our polls today and pass it off to our guests. So doctors, we're ready whenever you are. I'm not sure if you are speaking. Okay, all right, thank you.
Okay, great. We just wanted to give it, the participants enough time to complete the poll. Hello, everyone. I'm Uche Blackstock. It's a pleasure to be here. I'm an emergency physician by training and founder of Advancing Health Equity. And my sister and I are very excited to be here with you today to cover this content. We know that providers play such a large role in counseling and educating patients about COVID-19 vaccinations. And we hope that there will be some techniques and skills that you'll be able to take back to your workplaces for your interactions with your patients. Thank you.
Thank you, Dr. Blackstock. It's such a pleasure to be here. I'm Oni Blackstock. I am a primary care and HIV physician and also founder, executive director of Health Justice, and concur with the other Dr. Blackstock's points, hoping that there are useful skills that you learn today that you can then apply to your clinical practice when it comes to speaking with patients about COVID-19 vaccines. So I'm trying to advance. Looks like it's not advancing. I think Allie is going to be advancing, so I'll be saying next slide. Great.
Yes, thank you.
Wonderful. Okay, so the training objectives for today are: 1, to understand the rationale for motivational interviewing; 2, become familiar with the basic principles and spirit of MI, so motivational interviewing for short, and then describe how the brief negotiated interview, which uses MI principles, can be used to motivate vaccine acceptance by building vaccine confidence. Next slide. So the training outline, so we'll be first covering some COVID-19 vaccine related concerns and the role of healthcare providers in promoting the vaccine, then move on to motivational interviewing principles around counseling patients about the vaccine, and then an overview of the brief negotiated interview to motivate vaccine acceptance. Next slide, please. Okay, great. Next slide. Okay, wonderful. So we know that every day more and more New Yorkers are getting vaccinated. On this slide, you can see as of this Monday, about 44% of New Yorkers are fully vaccinated, and just over half have had at least 1 dose. When we look at New Yorkers by race ethnicity, however, we can see that there are certain groups that have been less likely, a lower proportion of those groups have received the vaccine, and those are Black and Latino New Yorkers predominantly. So we've made tremendous progress now that supply has increased, but we know that there are still New Yorkers that still need to get vaccinated. Next slide, please. And so we've heard, many terms to describe vaccine hesitancy. Some of those are vaccine contemplation, vaccine vigilance, ambivalence, skepticism, deliberation. But what these really are valid and justifiable vaccine-related concerns. Next slide, please. So the health department is working to build confidence in the vaccine among all New Yorkers, and recognizes that there are many reasons that some New Yorkers may have concerns about getting vaccinated, particularly those New Yorkers that come from communities that have faced both historic as well as present day racism and discrimination. And these are some examples of past incidents of racism and abuse. So images from the U.S. Public Health Service study at Tuskegee, picture of Henrietta Lacks. Cells were used and have continued to be used in research. They were initially used without her family's permission. Again, Guatemala, the U.S. government conducted syphilis studies, and then the pill studies that were conducted in Puerto Rico in the 50s without appropriate informed consent. And then we see that, still we have healthcare providers in particular who may hold false beliefs about biological differences between Black and white people, which have implications for treatment. And so that affects, the level of trust that patients might have. And also another image from Irwin Detention Center in Atlanta, when there was news found out that women were being referred to a healthcare provider who was performing procedures without consent. So we understand that people may have concerns. Next slide, please. So what are the common vaccine-related concerns? So this was from a few months ago from Kaiser Family Foundation, and they interviewed a number of Americans who were wait and see. And among Black and Latinx respondents who were wait and see about the vaccine, concerns were high about getting sick with COVID-19, vaccine safety, efficacy, and side effects. So how safe the vaccine was, how well it worked, what were the side effects, and also about getting COVID-19 from the vaccine. However, what was noticed and that we've seen over the subsequent months is that Black and Latino respondents were very receptive to information about the virus and about the vaccine, and that in particular, Latinx respondents to this survey tended to be receptive to the message that the vaccine was available at no cost, and that a friend or family member or a healthcare provider they trust also got vaccinated. Next slide. And so this slide is really meant to emphasize, so what is the role that healthcare providers can play? Well, we can play a critically important role in vaccine education and uptake. As you can see here, participants were asked when deciding whether to get a COVID-19 vaccine, who are you very or somewhat likely to turn to? And among Black Americans, Latino Americans, and white Americans, you could see that a doctor, nurse, or healthcare provider was sort of the person in their lives that they were most likely to take advice from. And so we know that a recommendation from a healthcare provider is one of the strongest determinants of vaccine acceptance. Next slide. So now moving on to talking about motivational interviewing, some of the principles to consider when counseling patients about the vaccine. Okay, great. So, when offering the vaccine, it's recommended that providers start with a strong recommendation. So saying something like, everyone is now eligible for the COVID-19 vaccine. What questions, if any, do you have? Or it looks like, today you're due for your second dose. Next slide. However, patients may express some resistance or ambivalence when that's stated. And so what typically happens traditionally is that a provider may ask why the vaccine is not wanted or why there is hesitation. The patient will then state their reasons that they don't want to be vaccinated. But the challenge is that this dynamic often prevents the patient really from being open to the possibility of vaccination. It puts them on the defensive. And then by voicing their concerns again, possibly strengthens their argument against getting vaccinated. We often see sometimes that this dynamic can end in the persuasion trap, where the provider is trying to persuade the patient that the vaccine is right for them. They become the vaccine champion, and what ends up is an argumentative type of style of interaction. Lecturing can happen when the provider provides the full story about the vaccine, usually with way too much information, and that can be often counterproductive to the patient. It may raise additional concerns. And then lastly, end up getting into a yes-no style of back and forth, which is called the answer trap. The provider begins to ask a series of closed-ended questions that don't really invite insight from the patient. So none of these approaches really help to sort of advance the conversation with the patient or get the patient open to considering other possibilities. Next slide. So here's an example of that more traditional approach where the provider is sort of digging in and there ends up not really being much forward movement in the conversation around the vaccine. This is a brief cartoon. So apologies if the audience members could not hear. Maybe, was anyone able to hear? We'll try to work on that in between. I was able to hear, but it sounds like, well, you may need to also just increase the volume substantially. Okay, someone said they were able to hear. So it may just be on your end, just raising again the volume. So for those who were not able to hear, it was using a more directive approach. But what do we do? Next slide, please. When patients express ambivalence or resistance, after you announce the vaccine, the healthcare provider really should switch to rapidly acknowledging and really empathizing with the patient's concerns. Really, the objective of the vaccine conversation is to build as much trust and rapport as possible. And so active listening and using motivational interviewing techniques can help foster that receptivity. Next slide. So what is motivational interviewing? So in the sort of Bible of or the really core text for motivational interviewing, it's described as a collaborative, person-centered form of guiding to elicit and strengthen motivation for change. And it really focuses on exploring and resolving patients' ambivalence and centers really what are some of the factors that might motivate the patient internally. It really differs from really externally driven methods of motivating change. It doesn't impose change, but supports change in a manner that's really aligned with the patient's preferences and values. So MI, by definition, is collaborative. It's about a partnership with the patient that honors their autonomy. So it's autonomy versus authority, and seeks to really draw out or evoke the patient's own motivation and commitment. So some of the principles of motivational interviewing include expressing empathy. So that's when patients feel heard and understood. We know they're more likely to share their own perspectives and experiences. Supporting self-efficacy, supporting patients and knowing that they are capable of making their own decision and capable of changing their minds and of behavior change. Rolling with resistance, which is really avoiding confronting the patient when resistance arises and working to de-escalate to avoid a negative interaction. And lastly, developing discrepancy. So really helping the patient to examine discrepancy between their current behaviors and their values, as well as their future goals. And this helps to lead them towards that goal. So next slide, please. So a brief primer on some techniques for motivational interviewing. They can be easily remembered with the acronym OARS. So O stands for open-ended questions. Those are questions that are not easily answered with a yes, no, or a short answer with limited specific information. So typically for open-ended questions, we usually start with a what or how. It can also be a statement like, tell me a little more. So moving on to A for affirmations. These are statements that really recognize patients' strengths and provide encouragement. R is for reflections or reflective listening, which are short empathic statements that reflect what the patient has said, either in terms of the content or how they have said it. What is the emotion of what the person is saying? And then lastly are summaries. These are a special type of reflection that kind of summarizes and recaps what has occurred up to this point in the patient visit or part of the patient visit. Next slide, please. So examples of, for instance, open-ended questions, or just to highlight is, again, really intended to invite elaboration and get the patient really thinking about an issue. And some examples are saying things like, what might be some good things about the COVID-19 vaccine? And then pausing and actively listening to the patient. Or what might be some less good things about it? What would make you want to get the vaccine? What would convince you to get it? So really understanding the patient's motivations and allowing them to be able to say what they are in their own words. Next slide, please. So affirmations, again, are a key element of supporting patient self-efficacy. They demonstrate that you value your patient and their efforts. They help with building rapport. And they should always be very specific and congruent, so aligned with what the patient has communicated to you and genuine. So some examples are, I appreciate that you are willing to speak with me today about your concerns about the vaccine. So appreciating the patient's willingness, and you're really doing a lot to stay safe from the novel coronavirus. So these are examples of affirmation. Next slide. So reflections are really first about expressing empathy and letting the patient know that they are being understood. And beyond this, they can be really helpful in terms of guiding the patient towards change by oftentimes highlighting pros and cons, which I'll talk about a little later. So for instance, patient says, I know you have said that there are important benefits from the COVID-19 vaccine. but I'm unsure if it's necessary for me to get. And then the provider then reflects back what they're hearing. So even though I've encouraged you to get the vaccine, you're still feeling unsure if you need it. Next slide. So there are lots of different types of reflections. We're just focusing on simple reflections where you're sort of repeating back what you are hearing from the patient. And so, if a patient is, ready to make whatever change, ready to get the vaccine, it's helpful also to reflect back, all the reasons that the patient has stated they want the vaccine. If the patient is unsure about getting the vaccine, then you would want to reflect back what you hear, stating the cons, their concerns before the pros, so that you end on the positive. And then if they're just not ready, you want to reflect back that you hear their concerns and affirm with them that their concerns make sense in terms of how they are thinking about things. Next slide. And lastly, our summaries. And again, these are special applications of reflective listening, and it communicates you're interested in what the patient is saying, you're understanding, and it can also be helpful in demonstrating discrepancy if there are things that the patient has said that may not necessarily fully align. So you want to reinforce, again, what has been said. Usually begin with, let me see if I understand so far, what we said, and then you summarize. Here's what I've heard. Tell me if I've missed anything. If the patient then expresses ambivalence, it can be helpful to include both sides, pros and cons, in the summary statement. So saying, on the one hand, I hear you saying XYZ. On the other, I hear XYZ. And then ending with an invitation. Did I miss anything? Is there anything more that you want to add or correct? Next slide. And so, oftentimes, we're dealing with, patients may be, resistant to something that we're proposing. So rolling with resistance really involves approaching resistance without judgment, and really interpreting it as a sign that really the patient and provider have different perspectives. And so rolling with resistance really helps to shift the focus of the discussion, and may involve, reframing what the patient has said, to prevent really that resistance from affecting the interaction. So you want to avoid arguing with the patient, trying to convince them to get the vaccine, dismissing their concerns, shaming them. Again, using fear as an appeal is not helpful. And then our inclination to want to always correct patients. So if they're saying something wrong, to say, no, this is the correct thing to do. Instead, consider asking an open-ended question if you are getting that resistance, to clarify where the patient is coming from, and then reflecting back what you hear, and offer a positive perspective on what the patient has already done up until this point. And again, making sure to support the patient's autonomy. So next slide, we're going to show a quick snippet of what rolling with resistance looks like, or sounds like. Okay, great. So that was a brief example of rolling with resistance. Next slide. Okay, great. And so now we're going to sort of put some of these parts together and just go through something called the brief negotiated interview, which is a framework for sort of integrating these motivational interviewing skills. Next slide. Okay. So a semi-structured, so brief negotiated interview is a semi-structured interview process, again, based on motivational interviewing principles and techniques that can be very effective and can be completed briefly, so in 5 to 15 minutes. And it really helps healthcare providers to explore behavior change or, a patient's outlook on an issue in a way that is respectful and non-judgmental within a finite period of time, because we know that providers don't have tons of time. And so instead of telling the patient what changes they need to make, this BNI, or brief negotiated interview, is intentionally designed to elicit the reasons for possible change and action steps from the patient. And so it gives the patient voice and choice, and leaves them feeling more empowered versus if we were directly telling them what they need to do. Next slide. And you know what, I actually realized before we start this slide, I think we were supposed to do 2 polling questions after the rolling with resistance. And so I wonder if we can just bring those up now for the audience to just take a look at.
Sure, yes, we've had our poll open for about 2 minutes, so we will close it now, and then you'll be able to see those results and speak on them in just a moment.
Okay, great. Okay, so the first question was about all of the following are examples of open-ended questions, except can you tell me your thoughts about the vaccine? B, what concerns you most about getting the vaccine? C, are you satisfied with the information provided today? Or D, how do you think you will feel after you've been vaccinated? And so C is an example, are you satisfied with the information you provided to you today, is an example of a closed-ended question, and it looks like most people got that correct. And then the next question was reading a statement, and I'm not sure if people could fully see the statement. It says, you've really taken a lot of important steps to keep yourself safe from the virus. You've been so resourceful, is an example of an open-ended question, B, a reflection, an affirmation or summary. And it looks like most people, I don't know if people, those who were able to read it, again, were correct. That's an example of an affirmation. Okay, great. So back to the brief negotiated interview, the first step is really about really building rapport with the patient, beginning a general conversation and asking permission to discuss the vaccine. So what this could sound like is, Mr. Perez, it's great to see you today. How are you? I'm well, Doc. How are you? I remember your last visit, we spoke about COVID-19 and your concerns about the virus. I know it's something you wanted to protect yourself against. Well, you're now eligible to receive the vaccine, and I'd like to offer it to you today. And Mr. Perez says, I'm not sure, Doc. I know there are some good things about it, but there are aspects of it that make me worried. And then the provider says, I understand. Would you be open to learning more about the vaccine today? So again, inviting the patient to asking them if they want to learn more. Next slide, please. The next step, step 2, is exploring pros and cons. And this is usually done through using open-ended questions and through reflecting key points back to the patient and summarizing. So for example, open-ended questions to explore pros and cons would sound like, help me understand your concerns about the vaccine. What might be some of the benefits that you see? And then reflecting back, saying, on the one hand, you said, these were your concerns and listing them. On the other hand, you said, these are your benefits. So again, ending with the positive and allowing the patient to really think about what you've now shown them. Next slide. So the next step is then providing information, once you've heard the patient's pros and cons. And what's recommended is that be done using the elicit-provide-elicit approach, which is first eliciting permission from the patient. I'll go through those steps, then providing information, and then eliciting a response, asking how has the information I shared with you, how has that maybe changed your thinking or affected your thinking? So next slide. So again, elicit permission, that's asking what the patient knows or would like to know, or ask if it's okay if you share information. Next slide. And so what that can sound like is, would you be open to my sharing some information about the vaccine with you? Would it be okay if I tell you what we know about the vaccine? Would you be open to learning more? So just again, open-ended questions, asking permission. Next slide. Then the next step is, again, providing information. So we want to make sure that we're giving information in a neutral, non-judgmental fashion, and that we're avoiding I's and you and shoulds, and we're dropping small nuggets, a small amount of information, and pausing just to make sure to answer any questions that the patient has and to ensure their understanding. Next slide. So providing information could sound like research suggests, studies have shown, what we know is, folks have found, others have benefited from, etc. Next slide. And then lastly, then eliciting a response. Gather what the patient's interpretation was, what their understanding was, what else they'd like to know, and what they make of this information. Next slide. What that can sound like is, how does this impact your decision? Where does this leave you? Given what I've told you, what else would be helpful for you to know that would help you to make your decision? Where do we go from here? So just following those steps when we're providing information to the patient. Next slide, please. Okay, now I'm going to show a brief video. Highlighting, showing the elicit-provide-elicit approach. I think this. Okay, great. And so there's a polling question up. What is the first thing that you should do prior to sharing information with a patient? A, background information. B, ask permission. C, remind the patient that you know what is best for them. Or D, let them know the information you'll be sharing will definitely change their mind. Allow time for participants to vote. And we'll try to work on making these video clips available for those of you who are unable to hear the sound. Okay, great. So the poll has ended, and we're waiting for the results. But just to say that the response to this question that was correct is to ask permission again before sharing information. Next slide. Okay, and most people were able to get that response. Okay, great. Another point that I wanted to make sure to raise is that when we are, when patients are sharing their concerns with us, that we, especially concerns related to historic and contemporary oppression or present day oppression, the importance of really validating patients' concerns. And so it may come out in some of the conversations that you have with your patients, some concerns that they have based on historic experiences, current experiences, and to acknowledge that there are, these are the realities for many people that may have led to mistrust, including the patient may have had, negative experiences in the healthcare setting. It doesn't just have to be restricted to the healthcare setting. That then influences the ways in which they're thinking about the vaccine and engaging with it. It also communicates that, the patient's thoughts and behaviors and emotions that they're having around the vaccine are well-grounded, justifiable, and relevant and meaningful. And again, Once you validated any concerns that the patient has, want to ask for permission to share information with them. The next slide gives an example of that. So you could say something like, given racism, past and present, that Black Americans or other people of color have faced, it makes sense to believe that providers aren't looking out for your best interests. So it's understandable to be cautious about the vaccine and to wonder if the vaccine or other medications really work. Would it be all right if I shared some information with you about the treatment and you can tell me what you think? So this is one way, again, it's validating what the patient has said, saying whatever they're feeling, again, is justified, is understandable, and then again, asking permission to share information that may be helpful in their thinking. Next slide. So step 4 involves then assessing readiness. So, after you've had a conversation with the patient about pros and cons, you've provided information, you've asked them, you've elicited a response from them after you've provided information, then you want to assess readiness. And that can sound like, now that we've had a chance to talk about the vaccine, where does this leave you in thinking about having your first dose today? And so you want to give an affirmation if the patient is willing to consent to vaccine or open to more discussion. So something like, oh, that's great, you made a decision to go ahead with the vaccine. Or if they're considering it, say, I'm really glad that you're considering it. So using an affirmation at context. And then if a patient is not interested or not willing today to get the vaccine, saying something like, I can give you some information to take home. And the nurse call you in a week or two to answer any questions you might have. What sounds best to you? So just really trying to keep that door open. Again, asking, whether they can be contacted, whether more information can be given or any questions answered. Next slide. And then the last step is really about negotiating an action plan, or almost summarizing an action plan that reflects the degree of willingness of the patient. So if the patient has agreed to get the vaccine, you could say, I'll tell the nurse you've decided to get the vaccine today so that he can come and administer it to you. If the patient is still deliberating, something like, maybe we call you to remind you about coming in for your vaccine. And for those who decline, asking, maybe talk about this decision again when you come in for your next visit. So these are just some ways, depending on the willingness expressed by the patient, that you can then sort of end with an action plan. Next slide. And so this is an example of all of those steps all together. So building rapport, eliciting pros and cons, again, providing information, again, assessing readiness, and then action plan. So this clip will show that all together. Okay. And just to say again, apologies for not having captions on the videos. We'll definitely try to get that addressed once the training is up on the website. Next slide. So to review, the brief negotiated interview involves one, building rapport with the patient. So again, that can just be about beginning a general conversation with the patient, and asking permission to discuss the vaccine with them. The next step is explore pros and cons. And we do this again using open-ended questions like, tell me, what are your concerns? Reflecting back. So what I'm hearing is this, and summarizing. On the one hand, it sounds like this concern. On the other hand, you're seeing these aspects of the vaccine as benefits. Then third step, providing information. And again, the recommendation is to use the elicit-provide-elicit approach. So asking for permission before providing information. And then once you've provided the information, assessing where the patient's thinking is about the vaccine. Then assessing readiness. So again, depending on if they're willing or considering, affirming that, and then leaving the door open if the patient is not ready at the time. And then lastly, an action plan reflecting the level of willingness that's been expressed by the patient. So these are the steps, and I know this is a lot of information, and apologies for going somewhat quickly through it, but hopefully we can take time during the Q&A, if anyone wants to take a screenshot of this, if that might be helpful, just to remember these different steps. And as you can see from the brief video, if you were able to hear it, that this can flow pretty well. So next slide. And just a reminder for providers around just collecting demographic data. So self-reported data, so moving on from obviously from counseling the patient to some of the work that we also need to do around the vaccine is making sure that the patient self-reported data, including race, ethnicity, and zip code, we know are really important in terms of collecting in order to inform the agency's public response. Unfortunately, these data are frequently missing from both vaccine and testing reports. And we know that collecting race ethnicity data is really important to identifying and tracking inequities, addressing systemic barriers to care, as well as ensuring that New Yorkers who may be at increased risk of exposure or severe COVID get the testing care and vaccinations they need. Next slide. And so some strategies that may be helpful in terms of collecting the demographic data are explaining to patients why it's being collected and ensuring confidentiality, never assuming anyone's race or ethnicity, using standardized questions and scripts to inquire about a person's race and or ethnicity. And there's a link that is there at the bottom of the screen that has access to some resources. Practicing empathy, cultural sensitivity, or structural competency, and providing language support, acknowledging the challenges of collecting race and ethnicity data, and assuring patients that their immigration status will never be asked. And we'll try to get everyone the link to the best practices resources. They were also sent out, I believe, as a HAN, as an advisory. Next slide. Okay, great. So I think we're only going to have about 5-10 minutes for questions, but would love to get any questions that audience members have. So, okay, great. So a question just came in. My question is in regard to vaccination in adolescents. Some parents may be concerned about the vaccine affecting their kids, especially those who are prepubescent, and how it affects their growth, development, and reproductive capacity. Is there data? I know there's no data stating the vaccines negatively impact this, but how would you navigate this inquiry? Yeah, so I think that's a really great question. And so I think so, similar to, what was presented really, again, so you've elicited, so affirming the patients, the parents' concerns in this case, and then, using the elicit-provide-elicit approach, may I share with you some information about what we know about the safety of the vaccine in these age groups. And so for 12 to 15-year-olds, obviously we have that information and it's been authorized. For younger children, we should hopefully have that information soon. But we can also say, we do have data from 12 to 15-year-olds, from some young adults that suggest that, that show that the vaccine is overall safe. And also speak to the fact that there's nothing specifically about the mechanism of the vaccine that we would expect it to affect, for instance, a growing child's, bones or reproductive capacity. So again, saying, what we know, sort of using, our knowledge as clinicians, and also like saying that there are some things that we don't know, but we do know, what the risk of getting COVID-19 is and what some of the outcomes could potentially be. So I would, again, share with the parent what we know, and also, acknowledge that there are things that we don't know, but, and give them that information and have them, decide, where does that leave you? What are you thinking now that I've shared that with you? And again, a lot of this is about keeping the communication channels open. So again, if a parent is really resistant, again, rolling with resistance, asking an open-ended question, and then, by the end of the encounter, if they're not, clearly interested, asking if in the future it can be revisited. So that's the approach that I would take. You're welcome. Are there any other questions that?
Yeah, it looks like there's another question about a little bit above Krishna's about, do you have any suggestions for how to get better at this method? Do you recommend memorizing it and pulling it up when the opportunity presents itself?
Yeah, that's a great question. A number of these approaches we use every day, we may not realize it. And it could be, for instance, so step number 3, providing information, using the elicit-provide-elicit approach. So elicit permission, provide information, elicit a response. This is something that, we're starting a new medication for blood pressure for a patient, we can use, for the flu vaccine, for any sort of medical treatment or intervention and that we're introducing, any concerns that the patient has, we can then ask, is it okay if I share some information with you? Providing the information, then asking, where does that land? So you could even break some of this down. You could say, you go into clinic, today I'm going to focus on affirmation. I'm going to focus on, affirming my patients and, acknowledging and validating the strong work that they've done to try to stay healthy in whatever ways they know how. So I might recommend, just one day working on open-ended questions, another working on reflective listening, and then also, again, rolling with resistance. We confront and deal with patients, with situations with our patients where there may be some disconnect or disagreement. And again, just using these different opportunities, they don't have to be in the context of COVID-19 for us to apply them. And it may be helpful also to have, something, on your desk, different strategies a quick reference when these situations come up.
Or even I think role playing, if time allows it, role playing with your coworkers and colleagues, I think could also be helpful. It looks like there are a number of questions in the Q&A. Looks like Paul wrote, I hear not appealing to fear, but with such a deadly virus, should the initial rec to get vaccinated include a blunt statement such as, more than 500,000 people in the US have died of COVID, and the vaccines almost eliminate the risk of becoming severely ill or dying due to the virus.
Yeah, that may not resonate with all people. That, someone might say, well, I'm staying inside or I'm doing this. I think it's important for us to provide information that we know our patients want and are interested in, or something that they have communicated a concern about, as opposed to just dropping information on them, because that may come off more fear-based. And again, we know that fear-based strategies often do not encourage folks to sort of do what we're hoping for them to do, and it actually can have the reverse effect. So I would recommend, again, asking for permission, and then really, getting the information from them first, so that you can then provide information that's aligned with what they have shared with you.
There's another question about if a patient presents a belief that is untrue, like the vaccine contained a microchip, how to respond in a manner that will actually seed doubt in this belief.
Right. Yeah. So I think again, having a context for why people might think that with the vaccine isn't, there's some microchip involved. Like, there's a reason why people have these concerns. So even exploring, why might you think that? Why might you be concerned about that? I'm sure people have very valid reasons for thinking a microchip might be in the vaccine. Affirming that and saying, however, this is what we know to be true. And stating that, obviously, if the patient is still very dug in about what their beliefs are, again, asking, and you're not making much movement, again, reflecting back what you're hearing, asking more questions to clarify, and if it's not moving forward, leaving that door open to ask if you can revisit that.
Someone's asking about how often and how can we revisit the matter of possible vaccination readiness for those of us who are working in settings with clients in which we meet with clients very regularly. The person is a social worker in a supportive housing setting, not in a healthcare setting.
So this is when, go on.
No, this is a social worker who sees potential clients frequently. So how do you not just infrequently, but sees these clients frequently, and how do you bring up the matter of vaccines to them? People that see it on a common basis.
Right. Yeah, no, it could just, well, I think, it's so important to make sure, obviously in your role as a social worker, that you're addressing, concerns that they have. It can be helpful if someone is talking about health related issues, say, oh, I know that you're very, very concerned, about your health, and, we know that the vaccine now is available to everyone. What are you thinking about in terms of getting the vaccine? Like, what are your thoughts about it? So, obviously I wouldn't just blindside, a client, but you could also say, something that I'm checking in with all my clients about is, their well-being, their physical well-being, making sure they're getting, all the checkups they need. How are things going with you? One thing I wanted to ask you about was the COVID-19 vaccine. What is your thinking about it? How good a fit do you feel like it is for you? And just like inviting that conversation, and hearing, again, so important to hear what the patient is saying, what they're seeing as concerns, and then also highlighting, if they've said, I really want to see my godson, but my godson, he's on immunosuppressants, whatever, and I'm really concerned. So going back to that, saying, but it sounds like you're very concerned about getting the vaccine, but there are also some things that you haven't been able to do as a result of not getting it. If you were to have the vaccine, it would be safer for you to see your godson, and saying, what are your thoughts about that? So again, just really all the questions to be just really open-ended, and again, aligned with whatever you're getting from the patient. And I know we have like 4 more minutes, and there's a poll, questions. And again, I know there was a lot of content that I quickly went through, but hopefully we will get to you the link on the website, and then make available the video clips with captions and with audio that everyone can hear. Do we have time for one more question? I'm sorry, I'm looking at the chat.
Yes,
Yeah, maybe.
thank you both. We definitely have time for one more, and thank you for highlighting the poll as well.
Let's see. No, someone had a question about.
And so
No,
just
go
want
ahead.
Oh, so sorry. Just quickly, as you were saying, opportunities for role playing, and I see it. Hi, Amanda, in the chat saying just to know that the health department offers, and I should know this, more trainings specifically on motivational interview, like whole day training. So just to make sure to check out the health department's TTAP program, and you can see that in the chat. Back to you, Dr.
No, there's a question about the Kaiser Family Foundation surveys found that political identity and preferences are highly correlated with vaccine reluctance. How would you discuss this source of distrust, mistrust in the value of vaccination?
Yeah, I know that for this, this talk and what we're confronting in New York City might be different from other parts of the country, but I would use actually the same strategies again. They would not be any different, again, using, building rapport, pros and cons, providing information, assessing readiness. I would use the same exact approach. I don't know if there was a question around provider humility that came in. Amanda, I don't know if you can resend that. For some reason, I cannot see the question. So I don't know if anyone else has questions, or Amanda, if you want to send in your provider question one more time.
I'm looking for her question. I can't see it.
You can just text it to me, and I know we have like one more minute. Okay, did everyone see that in the chat is the link to the training website? So if you are interested in getting more exposure or more practice with motivational interviewing, you can click on that link. And again, thank you to our co-hosts, the Greater New York City Black Nurses Association, Harlem Docs, Manhattan Central Medical Society, National Hispanic Medical Association, and the Brooklyn chapter of the NMA. And thank all of you for your attention, and feel free to, I don't know if our emails are here, but you can find us online, reach out if you have any questions. And again, this is the CME approved activities, so make sure to get your CME. And here is a list of additional COVID-19.
Thank you both for the wonderful presentation. We just want to reiterate to all of our attendees that the slides and these resources will be made available on our website by tomorrow. It's the provider webpage, which is linked in the chat and which you can also see on your screen in front of you. And our next webinar will be Friday, June 4th, same time, 1 to 2 p.m. We hope that you will be able to join us, and we will make that registration link available via email as well as on our website in the days to come. So thank you so much again to our guest speakers. I think we're getting a lot of wonderful feedback about the presentation, and we hope that you will be able to join us again in the future. And have a wonderful afternoon.
Thank you. So we're all done. Allie, are you still there? Is everyone still on? Oh,
I'm here. Yeah, we're just wrapping up. So we're going to close the event. Yeah. Thank you.
People are jumping off, but they can still hear. Hi, Odie. It's Mary.
Hi, Mary.
Really good to see you. This was so great.
Oh, good. I know when you said, well, this is, Monty was where we learned, well, I learned all this.
Well, the really funny thing is, I think that was the one day of residency I actually missed because I had strep throat, and I think I've regretted that my entire life since then.
Oh, no. Oh, no. So
finally got my makeup.
Yeah, no, yeah. I hope you're well. I hope all is well. But yeah, when you mentioned Monty, I was like, yes.
Oh, well, I hope you're doing well. We miss you.
Thank you. I miss you all too.
Yeah, not that we ever got to see each other very much.
I know, but just knowing